I was a resident in this hospital and then came back here as a faculty member because I loved my interactions with the people here and I felt at home. There are very few programs that are small in size, and we are one of them. We are a community-based program. We typically have 8 to up to 10 residents per year. We do not have fellowship programs, but it is the interaction with the residents and the faculty is very unique to this program. In our program, I think every faculty member knows every resident, at a personal level. We celebrate their baby showers, they get married, and they're very personal to us. We are a diverse group of individuals, both from the US, and there are a few international medical graduates as well who, in fact, 2 of my faculty members did their residency here. So that should definitely say something about the program, that it's a pretty strong program that actually retains some of its residents as faculty members. They want to give what they received.
And we have a very great program. It's a small community program, and that's what makes it special, I feel, because everyone is very well connected. It's an open door policy. You can knock at attending's door and even your chief residents and talk to them about anything you're facing, personal or academically, or even your residency issues. So it makes it very special. I felt very comfortable when I first came in as a first year. My chief residents were very welcoming, and it made me feel like as if I'm in the home.
We frequently have potlucks, and we get together for ice cream social, and they're invited to my house. If they get bored, they'll say, can we do something this weekend? So we do all these potlucks, and we share all these different cultures, and which is great. I think it's good for them to feel included, and it's good for them to feel at home.
Coming to academics, we have lots of lectures, and we actually have lectures like every day. Sometimes we have 2 in a day, sometimes 3 in a day, so that's a lot for us sometimes. And we do have outside slide conferences. They are unknown slide conferences, and we try to do in the areas which we don't get a lot of cases. We get a lot of cases in breast, GYN, GIs, and we have academically lectures from the Yale. We have blood bank lectures from the Yale, neurology lectures from the Yale, pediatric lectures, renal lectures, and we go to Yale for our outside rotations like blood bank, transfusion medicine, pediatrics, renal, neurology. So we get a lot of rotations there. And then we have OCME rotations, which is like we don't do in-house, it's a forensic pathology, and we do it for 1 month, and we get a lot of experience in there.
We also see a wide variety of cases. Like on average, I would say we get close to 30,000 specimens per year. Yeah, that's a lot of specimens, and we have a wide variety of cases coming through the door, ranging from breast cases, GI cases, GU cases, gynae cases. So we have a wide variety of cases, and we learn a lot because of that.
We have a very good frozen section room, grossing area, and very well developed our hematology lab, blood bank, transfusion medicine. Microbiology is very busy, and we get lots of specimens. We get to see almost everything in there.
I think pathologists are, I would call them the doctor's doctor, because if they do not give the diagnosis on somebody's biopsy or somebody's, I don't think the clinicians can, really treat any of them. So I'm constantly there to tell them how important their job is, and you might not be noticed, and you might not be told that you're a very integral part of patient care, but you have to realize that although you don't see the patients cannot get treated.
We have lots of research opportunities, and it's up to you how many research you want to do. I have done so many in my last 3 years, and I have been to all the national conferences. We have ASCP, CAP, and USCAP. So every resident gets an opportunity. You are allowed to pick any attending you want to, whatever your field of interest is, like what you want to do in future about your career. So it's all up to you. we have all the opportunities. Our program is very motivating about all those research opportunities. I would say you will leave with a lot of experiences, and you will be very good in presenting. You will be confident.
People that have graduated from the program, they've gone on to greater things. They get great fellowships in bigger centers. Definitely, this is a great program, and leaving the program, you are assured to move on to something greater. So.